Hey there, this is Dr. Matt Joosse at Joosse Family Orthodontics. I wanted to show off one of my favorite smile transformations of this past year. This is Lloyd, and Lloyd came to us after having orthodontics when he was younger, kind of a young teen. And he came to us because he'd had some bite changes happening. And specifically, he can't bring his front teeth together. We call this an open bite, which you'll see in just a moment. But if you look at his smile photo, you'll notice that you don't see a lot of his upper incisors. So this is him smiling pretty fully, and he just really doesn't show a lot of those front teeth. So if we take a closer look, you'll see that's because these upper front teeth, it's almost like they've gone up. You can see the level of these front teeth, and they're just not at the level of all the other upper teeth. And same with the lower teeth. These lower front teeth are down, not at the level of all the other lower teeth. And this is a situation where he probably puts his tongue into this space. We call that a tongue thrust. Sometimes tongue thrusts occur because teeth don't come all the way together, and there are reasons why they don't come all the way together. And so the tongue then has to occupy that space, especially when swallowing. And so a tongue habit, like a tongue thrust, can help form this bite, but it can also perpetuate this bite. And so it becomes kind of this feedback loop where it just keeps going and going and going. So you got to break the cycle by bringing the teeth together, not giving the tongue an opportunity to come into this space. And in fact, it's really helpful to work with a myofunctional therapist. You can think about like a physical therapist for the tongue, to help train the tongue on where it should sit, which is up in the roof of the mouth and not up in this space. And so, whenever I'm closing these open bites, I love to use Invisalign. I think Invisalign is a great tool for closing open bites. I prescribe Invisalign for most of my open bite cases, and that's for some mechanical reasons that I won't necessarily get into, but I think that it works really, really well. This is where we got to with Lloyd, and so this took us about 20 months, so a little over a year and a half. Great results, and I'm very, very happy with the way that everything came together. And I had encouraged Lloyd to be seeing a myofunctional therapist during treatment, and he did not do that, but he still got an amazing result because he's an amazing patient. He wore his aligners very diligently and just as we prescribed, and so he got this fantastic bite, and it also looks good. And again, this is Lloyd smiling big. He doesn't show a lot of his front teeth, but you can certainly see a difference from him smiling big here till when we started here, where you can't see all these teeth and you're actually seeing some of his tongue. Well, here's where we are now. He's really happy, and I'm just so happy for him that we got him this great result. So congratulations, Lloyd, on your awesome result. Thanks for being a great patient. Thanks for wearing your aligners exactly as we prescribed. And now when you bite into a sandwich, you can get the lettuce and the tomato, and when you bite into pizza, you can get the cheese. So congratulations on having this great bite. How do I know all that stuff? Because I had an open bite myself that I also fixed myself with Invisalign. So it works great for these open bite situations, and it's a much healthier bite atmosphere because the front teeth can help share some of the load of the back teeth, and it makes sure that the back teeth don't get as worn down prematurely. So it is a healthy bite thing, not just an aesthetic thing. But I always love when function and aesthetics go hand in hand. So giving somebody a healthier bite also makes it look good, and that's what we have here. So congrats, Lloyd. And if you know somebody who suffers from an open bite where the front teeth don't come together, please pass them along to us, and we're happy to take a look. We have fixed these with braces too, but again, I really prefer Invisalign for these cases. All right, thanks so much for listening.